Assalamu alaikum, dear students. The today's lecture is about the gross anatomy of the shoulder region. I am Dr. Karimullah, Demonstrator, Anatomy Department, GKMC Swabi. The objectives of the lecture will be to recognize the extent of the shoulder region, to classify and describe the muscles of the shoulder region, and to describe the origin, insertion, nerve supply, and the action of these muscles. The extent of the shoulder region. The shoulder is the region of the upper limb attached to the trunk and the neck. The bones of the shoulder region are scapula, clavicle, humerus, upper end, and some muscles they arise from the posterior skull and the vertebral column. They attach to the medial border of the scapula, the spine of the scapula, and the upper end of the humerus. These are called the extrinsic muscles of the shoulder region, and also we will discuss these muscles in the shoulder region study. The classification of the shoulder muscles. The major classification is extrinsic and intrinsic. The extrinsic muscles they arise from somewhere else in the body, that is the skull or the vertebral column. They arise and insert upon the bones of the upper limb, the shoulder region, that is the scapula, the clavicle, or the upper end of the humerus. The extrinsic muscles are classified into superficial and deep. The superficial are trapezius, latissimus dorsi, and the deep are levator scapulae and rhomboids major and rhomboid minor. The intrinsic muscles they arise within the bones of the upper limb and attach within the bones of the upper limb. These are also called the scapulohumeral muscles. These are called the deltoid and teres minor major muscle, and a group of muscle amongst these are called the rotator cuff muscles. These are called the supraspinatus, infraspinatus, subscapularis, and teres minor muscle. The trapezius. It is a long, broad muscle, and it arises by three parts: the upper, middle, and the lower part. The upper part arises from the external occipital protuberance and the superior nuchal line of the occipital bone. The ligamentum nuchae, which is a ligament present on the posterior part of the cervical vertebrae. The spinous processes of the C7. The middle part arises from T1 to T5 spinous processes. The lower part, which arises from T6 to T12 spinous processes. The insertion of trapezius muscle. The upper part insert upon the lateral third of the clavicle and the acromion of the scapula. The middle part inserts upon the acromion of the scapula and the superior edge of the scapular spine. The lower part inserts upon the apex of the scapular spine. The nerve and the blood supply of the trapezius muscle. The motor supply is from the spinal part of the accessory nerve, and the sensory is from the anterior primary rami APR of the cervical segment third and cervical segment fourth. The blood supply is from the thoracocervical trunk, which is the branch of the subclavian artery. The actions of the trapezius muscle. Uh, in short, these are rotation, retraction, elevation, depression of the scapula. Uh, The upper part performs upward rotation and elevation, the middle part retraction, the lower part depression of the scapula, and its accessory function is it assists in breathing and it enlarges the upper chest region. The latissimus dorsi muscle. It arises from the thoracic spine, the iliac crest of the iliac bone, and the lower three ribs. It is the only muscle in the body which arises from the bone of the lower limb and inserts on the bone of the upper limb, that is the humerus. Its insertion is in the intertubercular sulcus of the upper end of the humerus. The nerve supply is thoracodorsal nerve, and the root value of which is C6, C7, C8, posterior cord of the brachial plexus. Its action is it extends and adducts the arm at the shoulder and medially rotates the arm. The trapezius muscle lateral border and the latissimus dorsi muscle upper border and the lower medial border of the scapula, they meet each other and leaves a triangular depression that is called the uh, triangle of auscultation. Now the deep extrinsic muscles, these are three: the levator scapulae, the rhomboid major and rhomboid minor. The levator scapulae, first of all, the origin is from cervical 1 to cervical 4 vertebra. Insertion is on the medial border of the upper scapula, and the nerve supply is the dorsal scapular nerve. Its action is elevation and rotation of the scapula, and it laterally flexes the neck. The rhomboids major and the minor. The origin of the rhomboid minor is from C7 to thoracic 1 vertebra, and that of the rhomboid major is from thoracic 2 to the thoracic 5 vertebra. The insertion of both is on the medial border of the scapula. The nerve supply is the dorsal scapular nerve. The blood supply is the dorsal scapular artery. The action, it retracts and rotates the scapula. It, tilt, it tilts the glenohumeral joint inferiorly and fixes the scapula to the thoracic wall. The part 2 of the lecture of the shoulder region is the posterior scapular region muscles or the scapulohumeral muscles. The deltoid muscle. It is a tripinnate muscle. It arises by three pinna, the interior, intermediate, and the posterior. The interior arises from the lateral 1/3 of the clavicle, the intermediate, the lateral surface of the acromion process of the scapula, the posterior from the lower lip of the scapular spine, and the insertion is on the deltoid tuberosity on the humerus bone. The action of the deltoid muscle. The anterior fibers are flexors, the intermediate fibers are abductors of the humerus, and the posterior are the extensors of the humerus bone at the shoulder joint. They assist, the deltoid muscle assists the supraspinatus in abduction. The nerve supply of deltoid muscle is the axillary nerve. The teres major muscle. It arises from the outer aspect of the inferior angle of the scapula and inserts in the intertubercular sulcus or the intertubercular groove of the humerus bone. Its nerve supply is the lower subscapular nerve, and its action is it adducts and medially rotates the arm and it also extends the shoulder. The rotator cuff muscles. These muscles are also called the rotator cuff muscles because they arise from the scapula from all sides. They cover the shoulder joint and form a cuff around it. These are four in number. They arise from scapula attached on the humerus head. They pulls the head into the granite cavity of the shoulder joint. They give stability to the shoulder joint. Apart from collective function, they have their own separate action too. The supraspinatus muscle. It arises from the dorsal aspect of the scapula above the spine of the scapula from the supraspinous fossa. It inserts on the greater tuberosity and the nerve supply is suprascapular nerve. Its action is abduction. It assists the deltoid muscle. The infraspinatus muscle. It arises below the spine of the scapula from the infraspinous fossa and it inserts upon the greater tubercle of the humerus bone and its nerve supply is suprascapular nerve. Its action is lateral rotation of the arm. The subscapularis muscle. It arises from the subscapular fossa. The subscapular fossa is the interior surface of the scapula. The interior surface of the scapula faces the thoracic wall. Its insertion is on the lesser tubercle of the upper end of the humerus. The nerve supply is from the upper and lower subscapular nerve and its action is medial rotation of the arm. The teres minor muscle. It arises from the posterior aspect of the scapular lateral border. It inserts upon the greater tubercle of the upper end of the humerus bone. The nerve supply is from the axillary nerve. The axillary nerve only supplies the teres minor and the deltoid muscle, not any other muscle. The actions, the lateral rotation of the arm and along with teres major muscle, it holds down the humerus against the upward pull of the deltoid. Thank you, dear students. With this, we finished with the shoulder region, and next time we will come with a new topic, the brachial plexus. Thank you very much.